We're progressing in dentistry towards all ceramic, that is metal-free dentistry. Of course, we don't place the silver filling amalgams. They may have some mercury in them. We don't have an issue there. But we just know that the composite, the white fillings, are bonded to the tooth where the silver fillings aren't. They expand and contract similarly to the tooth structure, where a silver filling, big silver, metal expands faster and contracts just as fast. So if we have hot and we have cold things back and forth, we have this thermal cycling that can actually introduce cracks. So silver fillings, when they're small, work pretty well. A lot of times, though, at some point in time, they need to be replaced, and that's when we do place either a direct composite, or that we may have to upgrade them to a porcelain, either full coverage crown, or maybe it's just 3/4 of it. We sometimes call that an onlay. And so those would be, if you will, individual tooth cosmetics. When we look at more of the overall smile or the arch and such, we'll start to evaluate and see if there's spaces that we may want to correct. Rotation of teeth, angulation. Sometimes we're able to do just a little bonding on a tooth and not even have to put braces on to give that straightened appearance. Sometimes that sometimes can be one of my greatest joys, is to have somebody come in with one tooth that's just rotated and nobody's ever made an attempt to just put some bonding on there. And yeah, sure, if they lean their head back, they can see that the tooth is rotated, but boy, when it's straight on, it looks like, wow, did you just get braces? How'd you get braces in one day? You know, so that is a nice benefit of some of the cosmetic dentistry we do. I would go as far, then the higher level will be where individuals will do more of the upper front teeth, because that's really our smile. In that, you know, it's not just a lot of times to our canine eye teeth, it'll go a little bit more to the side to include those side teeth. As long as we don't see any darkness or in those corridors, it looks pretty good. And so there's a lot of that little studying of the individual smile, or also listening to what the patient is interested in doing. Sometimes they realize that they're not going to have the Hollywood smile and such, but they want improvement. And so a lot of times we're able to find good solutions for them.